All right, welcome everyone, and thanks for joining us for this webinar. Before I get into any background on this and introduce our speakers, I just wanted to give a couple of technical notes. There's no way for folks who are calling in or watching the webinar to talk to us, but you can interact with the presenters by writing a note into the bottom in that Q&A box, which should appear at the bottom of your screen right below the slides. And what we're going to do then is I'll sort of round up the questions and combine ones that are similar and give them to the presenters so they can discuss them and get back to you. But we're going to have two presenters, and then we'll have a long section at the end for Q&A. So probably we'll hold most questions for the end, but feel free to type in your questions at any point. So what we're talking about is the movement to make healthcare right for single-payer healthcare in Vermont. And as probably most of you are aware, Vermont has really made some incredible breakthroughs in recent years, and all of the country has been looking towards Vermont as leading the way towards healthcare justice. And just in December, there was a real shock when Governor Peter Shumlin in December announced, sort of made an about face. He had been supporting this movement for years, had run on this as part of his campaign platform for 3 election cycles. Announced that he said now is not the time. He recommended that the state legislature in Vermont not pass financing which would enable having a universal health plan, publicly financed, that would cover every Vermonter. And his reasons were that he said the taxes that were absolutely necessary to fund the system were simply not affordable. He claimed that there was a risk of economic shock by implementing this, and he said that there was simply no other way to do it at this point. So really, probably all of you in every state is dealing with the fallout of this. We knew that this was going to be a hard fight. There's just too much money at stake in the healthcare system, and there's going to be tremendous pushback anywhere where we get close, anywhere in the country and nationally. So this is an opportunity for us to talk to Professor Gerald Friedman, who's an economist. He's done economic impact studies of state single-payer plans all over the place. He also did an economic impact study of HR 676, the national single-payer legislation. So he's going to talk to us about, what exactly did Shumlin put out there as a proposal? Are his claims true that it's not affordable? To sort of go over all those details. And then we're also going to have Matt McGrath from the Vermont Workers Center, and he's going to talk about really the politics and the background of this movement and the next steps for them.
You are alone
and then I'd like to conclude the call by trying to talk about what we can do nationally. I noticed that in the wake of the December announcement by Shumlin, really there was a wave of right-wing commentary across the country saying this is proof that the movement for universal health care is dead and that it's just not possible, not economically feasible or politically feasible. So I think it's time for us to push back. We have to have a push in the other direction to show that it is possible and that this is mostly a political decision. So without further ado, I'm going to turn this over to our first presenter, which is Professor Gerald Friedman. Jerry, if you want to take this off at your first slide.
I labeled this presentation Politics or Economics because the governor's decision was more about politics than about economics. In fact, had the governor presented the report he gave on single payer, on Green Mountain Care, as an argument for going ahead, nothing would have to change. His report is a good justification for going ahead with the single-payer plan. His decision not to is all about the politics, that he didn't want to go to the business community with these types of taxes. But let's go ahead. Here's, state coverage, universal coverage needs a lot of money, no question about it. The governor's talking about $2.8 billion in 2017. That is a little less than 10% more than what Schau and Gruber had projected in 2010 when they made the report that led to the adoption of Act 48, the single-payer law in Vermont. I mean, I call it single-payer. It's not really single-payer. Maybe we should just call it Green Mountain Care, whatever. Okay. But the numbers that they're talking about are very similar to the numbers that were given out earlier. My estimate, which is a little more optimistic about the savings, would be $2.5 billion. 2.5, 2.6, 2.8 billion. We're in the ballpark. He says it's too expensive. It's always, when you talk to economists, you say something's expensive. The kind of our trained idiot response is, well, compared to what? It's expensive. Health care is expensive in Vermont. To give you a little side note here, Vermont is a difficult place to do a universal coverage plan because it's a poor state in an expensive region. Health care is just about as expensive in Vermont as it is in Massachusetts, but Vermont's incomes are a lot lower than Massachusetts' incomes. Prices are pulled up by proximity to New York and Vermont and Massachusetts, but incomes aren't pulled up as much. Okay, so compared to what? The state plan, which is the blue line over here. This graph shows projections for spending under the current regime, the Affordable Care Act regime, and they're rising steadily. Go to the next slide, you have the difference between Green Mountain Care and the current regime, the Affordable Care Act. These are the numbers. These numbers are based on what was given in the governor's report. The yellow line shows the savings, the net savings on administrative costs. That number you don't get from the governor's report. You have to dig and make comparisons with numbers that you get from the Centers for Medicare Statistics, and projections based on the rate of growth and spending over the last couple of years in Vermont. The governor doesn't actually give that number, but it's based on what they say administrative costs will be under the new regime compared to what I would project they would be under the current regime, the Affordable Care Act. The blue line gives personal health care costs under the current regime, the Affordable Care Act, compared to the Green Mountain Care regime. So that's based on what the governor's report has. In both cases, you're saving money. The red line gives the total savings for each year, 2017 through 2021. You're saving money under Green Mountain Care. So how can you say Vermont can't afford this? It's cheaper than what they're doing now. Therefore, the economic case has to be that it's a better thing to do. The total cost of health care in Vermont will be about $1 billion less in 2017, according to the governor's report, than what Vermonters will be spending under the Affordable Care Act. That's a lot of money, even more in a small, poor state like Vermont. Also, notice savings grow. The Green Mountain Care Board projects in the report that costs will rise at a rate of 4% a year. That is, rises to a percentage point less than the rate of growth in healthcare spending otherwise, projected by the Center for Medicare Statistics. So savings increase over time. The increase in savings over time is in the Green Mountain Care. They acknowledge that. They don't acknowledge the administrative savings, and while they give the numbers for personal health care, they don't actually make that comparison themselves. Which leads to another question. How do they achieve these savings? Since they're not talking about actually achieving savings, and they do say specifically that they are not getting savings from drug pricing, which is the obvious low-hanging fruit. You have a state board that buys all the drugs for the state and resells them to pharmacies. You can negotiate prices the way Medicaid systems often do and the way the Veterans Administration does, which buys drugs at 40% less than the rest of us pay. They're achieving those savings by driving down prices, by lowering the prices to providers. Some of the providers will be able to achieve these lowest prices by reducing waste, administration within their system, because they won't need as many billing and insurance-related people. which is the kind of thing that we're always talking about, single payer achieves savings in administration. The other piece, although they don't say it, is I suspect they anticipate getting lower prices from elite providers. This is something that is a little touchy because it's getting after part of the healthcare system. But we all know that certain providers in Vermont, the Ethan Allen Hospital System, in Massachusetts, Mass General, Partners Healthcare, other providers in other states, elite providers, university associated, charge much, much higher prices for the same services. I suspect that the Green Mountain Care Board is going after those prices, and that's part of the savings that they're getting. They don't say it, so they can't say it. Okay, here's the funding. They're projecting, you're going to need $4 billion. Some of that will come from existing Medicaid money from the feds. They're expecting to roll in the the ACA subsidies, $100 million. They're projecting taking $344 million of state Medicaid money that's already being spent or already budgeted, so to speak, for 2017. We're going to come back to that. Then they have two taxes, a payroll tax of 11.5%, capped at the first $200,000 or so of income, of payroll income for a person, and a premium that's a sliding scale progressive income tax that goes up to about $229,000, I believe it is, of 0% of income for low levels, and then goes up to 9%. But again, it's capped at, it's only for the first $225,000 or so of income. Together, those will produce $2.8 billion, nearly $2.8 billion, which covers the whole system. You get $4.3 billion from the federal Medicaid, federal ACA, state Medicaid, and these two taxes. Now, there are some odd things about this. Now, the first thing that's not odd is it's a big gain for most Vermonters. This graph is taken from the report. This is what they acknowledge. 92% of Vermonters will save money. The increase in cost will be for the top 8% because of the progressive income tax rate. They're going to be paying more. And you get a savings for everybody through the shift to the upper income levels and by savings. The total cost of health care will be less. So most people are able to save money. This is the kind of chart that, I've done things like this for a lot of states. I usually have a more progressive framework, so, it's a little better for low income, a little worse for high income. But this is basically what we all find and what we're all always going to find from a shift to a tax-funded system rather than the current system, which is basically everybody has to pay the same amount. Second, large businesses will save a lot. Governments will save a lot. Large businesses will be spending more. Small businesses will be saving. Governments will be saving. Municipalities will be saving money. It's basically good for business because businesses that are providing health insurance now, small businesses that are providing health insurance now, pay high rates. When people say small businesses will be hurt by a shift to single payer, they're only talking about the businesses that don't provide health insurance. The businesses that do provide, small businesses that do take care of their workers and do provide health insurance are getting screwed under the current system because they pay higher rates. Governments are also heavily subsidizing the rest of the economy for health care because government workers get who take a family plan free up the private sector spouse from having to get health insurance through their employment. The reason health insurance is more expensive for the public sector is mostly not because governments provide better health insurance. It's because there's a higher take-up rate and a higher proportion of government employees get family coverage. What they're doing is they're subsidizing their private sector spouse. So this eliminates a shift to a universal system, eliminates the subsidy, so governments get a big benefit. Small businesses that provide health insurance get a big benefit. Not much change for the large businesses, and here's important for the politics. Small businesses that don't provide health insurance, which is about half of small businesses in Vermont, they will be paying more. Currently, they're free riding. Somebody else is taking care of their workers, but they will have to start providing through the payroll tax, and that's going to be a hit to them. So one thing that we've learned in Vermont is it's difficult to make a change in health care that has dramatic winners and losers. The winners, governments, the uninsured, don't mobilize as much as the losers do to protect what the losers are trying to protect what they have. Small businesses that don't provide health insurance are big losers under this program, under any single-payer plan, under any universal coverage plan, and they don't want to have to pay it. Okay, that said, one thing I've observed, and Matt, maybe will have better insights about this. For several years, I admit I've been kind of waiting around for somebody in the governor's office to contact me about, what I think about the ideas. I mean, I've done various projections on my own and things, and I did have a conversation last year with Costa from the Green Mountain Care Board, one. And I did talk to somebody over the summer repeatedly about the governor's, advertising plan, which didn't seem to really go anywhere. What I concluded from all this, plus from the governor's own pushing off the, proposing anything formally, was that the governor was not serious because he was scared of the financing. He was scared to talk about large tax increases. And he didn't anticipate that people who would benefit would be as mobilized as people who, would be losing. And the governor was hoping something would happen. They'd win the lottery, and they'd be able to pay, without high taxes, or, some miracle. I don't know, But the governor was kicking it down the road, hoping something would happen. Then he kicked it down the road past the point where he almost got defeated for re-election, and he just gave up on it. Having given up on it, they tried to put into this report things that make it look worse. It's hard because anything that saves $1 billion for Vermont can't look all that bad when you get down to the details. But they did do some strange things. I don't know where, remember that $340 million? I don't know where they get that, because Vermont, by my estimates, should be spending close to $600 million on Medicaid in 2017. So, I don't want to question people's integrity here, but they're doing something that's it's not obviously a good thing. They eliminate the current tax on providers. Currently, hospitals and some other providers in Vermont pay towards basically a free care pool. They're getting rid of that because they're saying, well, there's not going to be any free care. Everybody will be covered. Yeah, but currently those providers are paying to cover people. Why shouldn't they continue to pay to cover people? There's $150 million. They have a cap on what upper-income people will be paying. That's comes to my estimate, $27 million. I don't know why you want to cap what upper-income people pay. They can afford it. It's like, and then they provide that the Green Mountain Care Board will have to collect its own reserves. I'm not sure about this, but I read somewhere that insurance companies need to keep like 6 months of reserves. I'm not sure what the number is, but they plan that the state will bond for these reserves and pay off the bonds over time at $44 million a year. To me, it's like the private insurance companies are holding on to our money in these reserves. We had contributed to those reserves through our premiums. Those reserves should now be transferred to the state, to the Green Mountain Care Board, or refunded to the individuals. But it makes more sense, I think, to pass it on to the next insurer, which would be the Green Mountain Care Board. Take all that together, you have $462 million in savings. If you just applied that to the payroll tax, you'd be under 8%. Okay, and then, well, that's it. So the governor's report, I think, makes a good case for single payer. His decision not to go ahead with it is political because he was scared of raising taxes on small businesses. He was scared of raising taxes on the rich. I understand the politics of the situation, but yeah, I wish he had just said the truth, which is he had a political problem because he does not have an economic problem. Economically, his report makes a good case for going forward with universal coverage in Vermont. Yeah. Well, thank you all very much, and I'm happy to listen to Matt and to take questions.
Great. Thanks, Jerry. And thanks to the more than 100 people who have joined us. And I'm keeping track of all your great questions, and we're going to get to them after Matt's presentation. So Matt McGrath from the Vermont Workers Center, you want to take it over, talk about the organizing side?
Sure do. Thanks, Ben. Cool. Well, thanks, everybody, for joining us. Thank you also to Professor Friedman, Healthcare Now, everybody who helped put this together. And I think I just want to reiterate that, at the Worker Center and the Healthcare as a Human Rights Campaign here in Vermont, we agree with Professor Friedman's assessments, that this is politically motivated. And, we've known a long time, lots of reports have been done, Dr. Shao and then Gruber, and now, the governor's own report, and then analyses on his report from Professor Friedman and others that suggest we can do this. So obviously the side, our campaign has largely been focused on people, and, the crisis, as it does in every other state, continues in Vermont, with people still having, not getting the access that they need to care, and, going into financial debt because of, eventually accessing that care. And so, for us, that paints the other side of the picture. We can't actually afford to wait to move forward with a universal publicly financed single-payer system for the human cost in addition to the financial cost. So at any rate, I did want to just back up a little bit and give some context. I imagine many of the folks who are participating in this call have a sense of the trajectory of what's happened here in Vermont and through the health. I'm going to give a brief context. I think will help lay some groundwork for where we're at politically. So I just wanted to start off by, and I'll obviously give a perspective from the Healthcare as a Human Rights Campaign. We are one of many groups in Vermont working towards, a universal single-payer system, and, this will be from sort of our perspective. One of the reasons I just wanted to lay out that from the beginning our campaign chose to identify with a human rights framework and organize around healthcare as a right. I think we've learned some lessons about actually how that has helped and positioned us, in a more hopeful place right now. Part of what I hope to inspire here in this call and, every day with people that we talk to in Vermont is that, this isn't dead. Just because the governor says it's dead doesn't mean that it actually is. And, we actually have to recreate the political mandate for other political champions to step up. And I think many of the components that we've helped to put in place through the Healthcare as a Human Rights Campaign are positioned us well to do that. So what I mean by that, I guess, is that from the beginning, rather than strictly talking about a policy, to best achieve our goals of covering everybody, streamlining the system, making it more affordable, the goals of a single payer, we went ahead and talked about it more in this rights-based framework. And, we believe that was helpful in many ways. It was helpful in that we were able to really center the campaign and the crisis around people, lifting up the stories of how people were, being affected by the crisis. And it allowed us to organize a lot deeper, for a lot of people who don't have the time or the education, just the capacity because of their struggle on a day-to-day level. We're able to engage in conversations around, the specifics of what's happening to them in their real life and how they're not getting the care that they need. And it's allowed us to build a base of people that was broader than, what's often sort of the traditional single-payer activist crowd, which, ultimately helped build more political power, which we were able to then, or which then politicians, and namely Peter Shumlin, was able to utilize for his own political benefit, for multiple election cycles. Additionally, we found that organizing in this way has helped us on the political landscape as well. When we were moving before 2011, as we were moving through the process with politicians and drafting laws and moving us towards what was known as the sort of the breakthrough law in 2011, the Act 48. We were able to use our human rights principles as part of our process, both to help our communities better be able to talk about what a single-payer system was or a universal healthcare system was. People are able to talk about universality and the concept of equity, that everybody pays what they're able to and everybody gets what they need, and democratic principles around participation and transparency and accountability. It made people be able to feel more confident in having conversations with their legislators, et cetera. But additionally, we were able to then embed many of those principles into the law. And that piece has actually been really useful subsequent to 2011, when it's been a long time now. There's been a lot of space for different organizations, interest groups, and stakeholders in this to be like debating with how we move forward. But we found that having these principles of universality, of equity, participation, and the concept of a public good actually embedded into the law, into Act 48, has helped us be able to keep the fight and the focus principles, and it's allowed us to offer tools to our policymakers, should they choose to use them, to continue to also maintain this conversation in a principled way. So that was an important piece of where we're at now, and I think which has been useful. Also, I'll just say, what we also, a major lesson that I've taken, recently, is that up until 2011, when, this wasn't yet law, we found that at that time, our campaign in particular over those 3 years from 2008 to 2011 was able to really set the timeline, build our own campaign on our own timeline, set the dates, and build momentum in a way that was strictly ours. And then, once the bill passed in 2011, basically the timeline was on some level taken out of our hands and put into the government's hands. There was actually deadlines. In 2013, the governor was supposed to put forward his proposal for how to finance this. He missed the deadline, had a lot of reasons why. Some of which, I think Professor Friedman was alluding to around the politics of not wanting to have something out there that could get beat up, and not confident that the winners in such a system would outvoice the losers, and so chose to not do that. And we were unable to really hold them accountable, and so it was hard for our campaign to latch on and to mobilize around a timeline that was ever changing. And we found that it's difficult to create a sense of urgency and to keep the movement strong. So that's just a sort of a lesson I wanted to point out. But some of the successful things that came out of that time frame included, we started basically what we call the Put People First campaign, and largely that was to do a few things. One was to unite some of our movement partners, people who didn't, for whom healthcare wasn't their number one issue, but certainly their membership did experience crisis in the healthcare field. So, by broadening our umbrella, so to speak, and outside of the healthcare as a human rights campaign, and we were able to unite organizations for disability rights, immigration rights, some of our union partners under a broader umbrella. So we were sort of fighting together, a broader austerity agenda. In part, we were trying to foreshadow that what we were expecting was that, this governor who, has, while at the same time speaking highly of moving forward and, championing single-payer health care, has also actually put forward, an austerity agenda of his own, and each budget year, offering as proposals significant cuts, like many governors across the state, across the country. And so we were trying to foreshadow the fact that we did not want healthcare to be pit against our other communities' needs. We were hoping that, this year, for example, if he was planning on moving forward with the financing plan, it wasn't going to be at the expense of other needs of our community. So that was sort of part of the rationale behind our Put People First campaign and then the People's Budget Initiative. And so it allowed us to help build up a base of people who were broader than just members of our specific healthcare human rights campaign as well. And I think, just so people have that larger context of what we're dealing with in 2015, this year there was an expected budget deficit of $100 million, which is also part of the context. So now all the other we have built, a better relationship with. They're also trying to protect what they see as theirs at the same time as, thinking about raising new revenue for healthcare. It's all, very complex, but I think an important part to note that, we're trying to bring all these other issues together, so we're not fighting with one another as can typically happen. So that gets to kind of where we're at in the moment. So, I think Professor Friedman articulated well, and everybody, I'm sure on this call has an assessment about, the governor and that the election happened in November. It was this very close margin of victory, and I think our opposition did a great job of framing that in a way that, made it seem like his agenda, towards moving forward with single-payer universal health care was a large factor in the close election. I could go on about our assessment of that, but that's the case. It was a close election, and then a few weeks later, he announced that this wasn't going to happen. And so that's where our organization had needed to decide how we were going to engage. And one other piece, actually, that, as part of our campaign building up until now for the last 6 or so years, we put a high value on political education, on, getting people into the organization, but then doing, real deep education, not strictly around healthcare and around our healthcare human rights principles, but around, the larger political context that we're in. And who's making decisions and why they're making decisions and what an austerity agenda looks like and what that means and who's winning and who's losing and so on. And it's I think been really helpful. At the same time, building a narrative that the only way that this is going to happen is if it's, if politicians are pressured and so moved by a people's movement, that when, it comes down to push comes to shove, if there is no people's movement behind what's, trying to transform a healthcare system from the private marketplace to, what's considered a public good, that there's no doubt that the business community and the, the insurance and medical lobbies will have far more influence with politicians than we will if we don't have a strong movement. And so, because we've been developing that narrative with our base for such a long time, when this happened, the governor's announcement, it was completely shocking, but not necessarily terribly surprising to many of our members. And so I think that provides us with a lot of hope in this moment where there's a lot of folks in Vermont who, expected this on some level, who knew that it was going to get harder before it got, before we won this. So I mean, I just wanted to point that out, like that's where we're at. But so the day of the announcement, many of our members were like completely enraged and felt we needed to take some action. So that's what we did. The next day, we had an event at the State House. We had bills. We marched to the Green Mountain Care Board and demanded from them that they continue to move forward with Act 48, as has been their mandate by law. We did get commitments from a few of the members that was their intention. And then, we had already been planning for this major action on January 8th, which is the second day of the legislative session and the day that the State of the State was to happen. And when, this happened, we realized that we needed to do something to change what the narrative was. Because at that time here in Vermont, the narrative is basically like the governor declared this impossible and not going to happen. And so we felt the need to engage in that dialogue and change that narrative. And actually we had tremendous support from, I think there's probably folks involved in this call from organizations like Healthcare Now and Progressive Democrats of America and the California Nurses and National Nurses United, who spent a tremendous amount of resources and volunteer capacity calling Vermont residents and asking them to come join us on January 8th which was you know, a very, which was a day I'm sure many of you all have heard about. There's been lots of, you know, conversations about what happened. And so I just wanted to note, like, why we took this action. You know, I put this slide up here. This was a young woman who's been involved in our campaign who is a student, and this was basically a story that she told us all while she was participating in the sit-in. And, you know, I'll just read it out loud, but I lost a stepdad to cancer because he couldn't afford treatment because he was self-employed. I've also been diagnosed with a chronic illness, and my life's now governed by whether or not I can afford to get better. For all these reasons, I participated in a sit-in in the Vermont State House on January 8th. We've already gone through the proper channels to change the system, and we have it in Vermont law that healthcare is a public good. For my stepdad, for myself, for my community, the time is now to act and end the healthcare crisis. So this is obvious to those of us on this call. I think this is, you know, this gets at the crux of why, you know, so many of our members felt it important to take, you know, direct action and civil disobedience. And, you know, there's been a lot of dialogue, particularly within Vermont, about the appropriateness of our actions. But, you know, I'm not going to spend time debating that on this call. I just want to, you know, lift up that hundreds of people, you know, who are directly affected by this crisis currently decided that, you know, the politicians and the democratic process was failing us. We had done a tremendous amount of work over years to move us in the direction of a universally publicly financed healthcare system because the system is completely broken and ruining our lives. And then, you know, one speech, one person tried to derail that process. And to us, that was incredibly rude and incredibly disrespectful and incredibly inappropriate process. And so for anybody to claim that, you know, what we were doing was those things, we just completely have a different sense of you know, of what's what. And so actually the day at the State House, for anybody who was there, was actually tremendously powerful. I did provide a couple of 1-minute videos to share. And I'll run them super quick. These are just things that happened at the State House. This first one I'll play was as the governor was walking through the halls to the inauguration. You'll see that we had packed the State House with hundreds of people, and everybody was singing. And it was like a tremendously powerful moment, and I just wanted to share this.
Strange things have happened here, no stranger would it be. Healthcare is a human right, a right for you and me. Our health, our lives, our bodies not for sale. The governor's promises, each one has failed. Strange things have happened here, no stranger would it be. Build a system good for you and me. Our health, our lives, our bodies not for sale.
Keep your promise. It's all about health care.
The system that has failed. Strange things have happened here, no stranger would it be. Healthcare.
Great. Basically, after what we were told before that, we had been in touch with a number of key legislators in the interim between the governor made his announcement and the beginning of the legislative session, and we were not assured of any process moving forward towards public financing. And so that's why we felt this was an important action to take. And subsequently, you know, there has been there's already been a joint hearing of the House and Senate Healthcare Committees to receive the governor's proposal. And we found out yesterday that they're also now about to schedule joint committee hearings to take testimony on some of the, I'm hoping that Professor Friedman has been asked to be a part of that. And we, at the Workers Center, our policy committee is actually in the process now of doing our own proposal. We've actually, another reason to thank Professor Friedman, he's been supporting our work there as well and providing some technical assistance. And we look forward to having our own proposal, which basically, you know, is grounded in a lot of what the governor actually put forward, but just tweaks some components, some of his assumptions, and most specifically, you know, we think, and we've said for a while, that you know, the burden on small businesses could be a problem, both politically and actually financially to these organizations. So we're proposing graduated, you know, progressive income payroll tax, which we think would help eliminate some of both that political challenge and some of the actual financial reality of some of those small businesses who don't currently pay. Moving forward, we actually have, had a recent action since then with a bunch of faith leaders to demonstrate that this movement is not just what they're trying to classify as a bunch of radicals, but actually is a broad movement of people, including the faith leaders who, said this was a moral imperative to move forward. Next week, we're going to be at the State House again, continuing to keep the pressure on with lots of people, our legislators, basically asking them to pick up the torch and move forward with is law in Vermont. And we think there's actually a lot of opportunity still, and we think that, we can move forward and pass an equitable financing bill this year that's going to set us on solid ground to, implement a universal publicly financed quasi-single-payer system here by 2017. While I have you all here, I wouldn't be doing my job as an organizer if I wasn't, asking for some support. And basically, anything that you all can do to help us here in Vermont would be tremendously appreciated, and I think would go a long way in building our movement nationally for a free single-payer national plan. And some of the things that came up to us that we could ask for help as writing letters to the editor that could come into Vermont or in your own local jurisdictions, helping support what it is that we're doing here, support continue to keep hope alive that this can still happen. One person doesn't dictate a whole political process. That we have a lot of hope, and this is still possible. The facts suggest it is. The people on the ground suggest it is, and we just have to move through the political hurdles. And we have a lot of social media we've been putting up. If people would share all that, that would be great. Any connections with national journalists to help lift up our struggle here in Vermont would be great. Also, obviously, contributing financially to the work on the ground would be tremendous to our organization or some of the other local organizations. And then, we'll probably have other massive days of action or opportunities where we'll need, to be phone calling our legislators. And so any help providing some support, calling our members and Vermonters to urge them to take action at different points during the legislative session would be great. And of course, we're hoping that there'll be some meaningful legislation on the table on May 1st, which is the end of the legislative session here in Vermont. Also, it's International Workers' Day, May Day, and so we're planning on a major action, and hopefully we'll have thousands of people to be, encouraging our politicians to follow through with whatever we've been able to accomplish by that point. And would love for you all to join us. At any rate, I'll leave it at that and look forward to hearing your questions. Appreciate your time.
All right, great. Thanks, Matt. And I think we'll, Jerry, if you could unmute yourself, and Matt, if you could stay unmuted. We've already got over 30 to 40 questions, but keep them coming. And while Jerry and Matt are answering questions, I'm going to pull up the other ones, and I'm going to try and group them together. The first question I wanted to answer is that we will have this available online, the whole thing. We'll have the presentation along with the slideshow. And some folks said that, the video didn't come through on their computer. We'll have the video made available to you, so everything will be available if you had any technical difficulties during this, and for folks who couldn't join us. So keep those questions coming. The first set of questions, I'm going to sort of group a bunch of these together. I'll direct it first to Jerry, and then Matt, if you have anything to add. One person asked, 8% payroll, 9% of income, and copays and deductibles. That sounds pretty bad. How is that better than what we have? And we have another number of other questions about how close was the governor's proposal to an actual single payer plan? How far away from this how far away was this from single payer? How good was it? Do you want to tackle that a bit, Jerry?
Yeah, I'll take them in the opposite order. It's obviously not a single payer plan because they weren't able to get Medicare integrated into it. Also, there are, TRICARE, military, Veterans Administration were outside. What is it about? On the order of 70% of healthcare spending, or maybe 60% of healthcare spending, was actually covered by the Green Mountain Care. It's obviously not a single payer because they're multi-payers. On the other hand, it would be a major improvement over what we have now. It eliminates most of the private insurance. It sets an actuarial value of 94%, at which point you have minimal copays, minimal deductibles. So it's providing real insurance, and it would be able to capture while they deny picking, they say they're not going to save administrative costs. They actually are saving a very large administrative costs, both in the insurance sector, which is largely done away with, and presumably within doctors' offices, although they don't spell out, that number. But they can't get the personal health care spending that they're projecting without achieving economies in doctors' offices. And there'd be no reason for doctors to continue to maintain such large billing and insurance activities because most of their billing would be going either to Medicare or to the Green Mountain Care. So it's not single payer, but it's not. It would be a huge improvement of what we have now. How much it would be costing with an 11% payroll tax and an income premium that would go from 0 up to as high as 9%. Again, this total amount that people would be spending, or the total amount that Vermonters would be spending, is very significantly less than what they're spending now. Vermont, as I said, it's an unfortunate position because it's an expensive place to provide health care, while many of the people in Vermont have relatively low incomes. So, you have your tax rates are higher, tax rates, whatever you call them, premium rates, whatever it is. The costs are higher than in a state like New York or Oregon or Pennsylvania or Maryland or Massachusetts, the other states that I've looked at. But it's still, it's less that, the Green Mountain Care would be less than they're spending now. So it's an improvement in that way. And as I said, it would be providing coverage for everybody, and it would provide a lower copays and deductibles. So, generally, it's a good thing.
Thanks. So for Matt, I have a group of questions here about, I'd categorize these as sort of outreach to different types of groups and constituencies in Vermont, or any state, I suppose. We had one question about, what are the benefits of this to those who have good insurance right now? What kind of a reaction did you get from those folks? And then we have a series of questions about small business people. Was there really opposition from small business people? Was there support? Could you talk a little bit about those on-the-ground politics?
Yeah, sure. As you would imagine, organizing with people who are struggling with the current system is easier. There are folks who have, it's been harder to identify people who have good insurance, who want to get involved in the campaign, in any serious capacity, that's for sure. And frankly, it's more powerful, we found, that having people be able to articulate how they're suffering or struggling within the system is more important in moving a campaign forward anyway, so we focused on those people. I will just say that we've, a few groups of people who fit into that category, are union members. For a long time we're reluctant to, even though we are a workers center and have supported the unions in Vermont in different ways over many years, through, contract struggles and so on, that we were having a hard time for many years really getting some of the larger unions to be on board with our campaign, until actually the ACA, because now, with the Cadillac tax components, set to come forward in 2018, a lot of the larger unions here in Vermont are starting to realize that they will likely fare better under a Green Mountain Care system than they would having to figure out now that their small group pool or whatever is going to be taxed under the Cadillac plan. So we've had success moving unions in that way. As far as small businesses go, it's been, as an organization, that's not really where we have focused. Some other groups, Dr. Deb Richter has, done some work talking to small businesses. There's another, like the Vermont Business of Social Responsibility. There's been a number of groups who have been doing some organizing of businesses, but, frankly, they haven't done as much to, and don't have as much influence as some of the larger business associations like the chambers, and so on, who've been, I think, successfully lobbying behind the scenes because the governor sort of cut it short of a real legislative process. We actually haven't seen a lot of the dirty, people coming out of the woodworks publicly. It's been a lot, so it's not hard to say exactly what kind of opposition there's been because it's been largely behind the scenes.
Mm-hmm. Thanks. We have another good group of questions. This one's for Matt. Then I have a question for Jerry after that. There's a lot of questions around who had a seat at the table in creating this financing plan. Was the Workers Center or any other single-payer advocacy groups invited to take part in that? How did the process actually happen, and who was at the table?
Yeah, that's a good question. We would say largely it was not very transparent. The governor created two councils, a business advisory council and a consumer advisory council. Our director, James Haslam, was a participant in the consumer advisory council. It wasn't open for lots of people. He was one, and they met, I don't know, once every few months for an hour to get a briefing, an update on the process. But frankly, there was very little input. We were able to meet with both Michael Costa and Robin Lunge, who were, in charge of staffing that, moving it forward throughout the process. But, for us, it felt more like, doing what they felt they needed to do politically than actually, taking our feedback. But it's hard to know. We did meet with them, but it wasn't a very public process. So I'm not sure which other organizations or which other individuals also had that same privilege. Our position is that, we had heard rumors that members of some of the Business Advisory Council actually had specific information about the payroll tax before it was out. There was a few weeks earlier that it was leaked in a press event story, and so, there's some indications that they had some more inside information than the Consumer Advisory Council. That fits with the narrative that, the governor is a businessman, and that's who his key constituency is, and that's who he would have, close to the chest. But like I said, it's really unclear because it wasn't super transparent.
Mm-hmm. Great. And so this question's for Jerry, or there's quite a few questions actually about the transition costs, and I think some folks came away with the question whether this is the surprise. Was this what surprised Governor Shumlin, that the transition costs were unexpectedly high? There's another question about, how do you deal with that if a lot of the savings from single-payer health care come over time, but there are large upfront costs to implement it? Is that a challenge, especially for a small state like Vermont? Can you sort of talk about that general, the financing of the transition?
Yeah, the transition costs are not a major issue. Basically what you need is everybody to get a card with a chip, like a modern credit card, and a card reader at the physician's offices. These are not great expenses. Yeah, then you do have to set up an apparatus to pay people. But they were going to use the existing Blue Cross Blue Shield network, which is the way Medicare was established. They contracted out the actual bill processing and paper shuffling. So that's not a big deal. And collecting premiums, well, you're collecting them through the tax system, which already exists. So the transition costs were not a major issue. Certainly were not a major surprise to the governor. As I said, the Green Mountain Care Board's report projects pretty much what was already being projected for costs by Shao Gruber, and while I was not involved at all, my own back-of-the-envelope calculations. So there really was not a major surprise. The governor talked about surprises, saying, we were hoping to get Medicare in. Well, not having Medicare in was not a big deal. And the governor talked about, we were hoping to get more money from the feds. Well, actually, what they project from the feds, the $106 million that they project from the ACA subsidies, is actually better than I had been projecting, which is, okay, so that says my calculations weren't that great. But, they're not doing badly, and the fact that they end up with, requiring taxes that are actually a little below what Shao Gruber had initially projected. So There actually were not major surprises economically. It was all about the politics. He feared going, keep in mind, Vermont now collects, $1.7 billion in tax revenues for the general fund. So they're talking about, collecting well over what more than doubling the total revenue collected by the state. And they just, he was just scared to ask for that much money after he was so narrowly reelected.
Mm-hmm. Great. There's a great question for Matt about what your strategy was for reaching out to rural areas of Vermont. This is from an activist in upstate New York facing similar challenges organizing in rural areas.
Yeah, well, this goes back a while now. Our initial organizing strategies are just to lay out, for the first nearly 2 years of the campaign, we had a focus on building in the communities and didn't actually even engage with our legislature at all. I see that there's somebody, Betty Keller's in this call. She's been asking lots of questions here, who actually is a physician from a rural area in Vermont who was very involved in that time. But, I think part of our strategy was, which we did similarly in the larger populated areas, is just trying to go out to public places in these places and start doing surveying, with questions like, do you think healthcare is a right? Do you have you ever experienced being stuck at a job because you haven't been able because of healthcare, or and just real straight up questions about how healthcare may have affected their families, and identifying people who in the crisis affected, and then sort of moving into, we did these community forums where we were talking, we basically said we were putting the system on trial. We had some of these people that we identified who have stories be able to speak in front of a panel of community leaders, faith leaders and other nonprofit leaders and so on, to really build a sense of community around this isn't an individual problem. These aren't problems with any individual not, pulling themselves up by their straps and all that. This is actually a systemic challenge. And, I think having those group spaces where people were sharing their stories was ultimately, the main piece in sort of building those communities, and from there we had organizing committees in some of the rural towns, people who identified as part of the campaign. That was the sort of, I guess, the building blocks.
Great. There's another question also probably for you, Matt. This person's question, that their understanding was that the original legislation passed in Vermont excluded undocumented immigrants. Can you address that, whether that's true or not?
No, that's one of the major sort of pieces of our campaign narrative, that it at the very last minute before, in May or April 30th, actually, of 2011, there was an amendment added that would have excluded undocumented immigrants. And because, we had done a lot of work around the concept of universality and some anti-racist work with a lot of our leaderships previous to that, and because we had been building a strategic relationship with a fledgling at the time organization called Migrant Justice, in a matter of days we mobilized hundreds of calls, and actually that was right when we had our first May Day rally, which we had over 1,000 people turn out, and actually a few migrant workers spoke at, and over the course of that pressure, we were able to defeat the amendment. So that amendment did not pass, and there has been no exclusions based on immigration status at this point.
Great. So I think we've got 1 more minute. I'm just going to try and take 2 more questions. We didn't get to everybody's questions, but what I'm going to do is we'll probably post this video up on our website, and in the comment section, anyone can ask questions, and I'll make sure that I point Jerry and Matt to it, and they can probably answer your questions in the comment section. So I think the last couple questions here, one for Jerry. Folks are still having a hard time with wrapping their heads around exactly how the financing works and how it affects just a normal working class person and a middle class person. There's comments that, they understand that the total spending is reduced in Vermont, but with a payroll tax like that and an income tax like that, shouldn't that really be hitting some middle-class people, working-class people harder? Can you sort of explain how, from a person's perspective, it results in savings?
yes, I mean, it does hit you. You'll be paying, 11% of your payroll. You'll be paying, a middle-class person might be paying 4% or 5% of their income. But keep in mind, if you're earning, $50,000 a year and you have a family health insurance plan provided by your employer, what you see may be your family health insurance plan costs $18,000. You see maybe $4,500 because you're paying 20% or 25%. But your employer is paying $13,500 in addition to the $4,500 you're paying. And that's money that could have gone in salary to you. So the cost of your health insurance plan to you is close to $20,000. Plus you have a copays, and you may have a deductible, which in Vermont averages about $1,700. So you're currently paying between $50,000 income is currently paying maybe $25,000 in health care. Under the Green Mountain Care Plan, if you have $50,000 income, you're paying $6,000 in payroll tax. You'd be paying another $2,000 or $3,000. That average person in Vermont would have been saving thousands of dollars under this plan. Poorer people who are, earn too much for Medicaid, but not enough to really, get much beyond, would be saving even more. And the rich people would be paying more. But the average middle-class person would be making out much better under this Green Mountain Care than they would have, than they do under the current system.
Okay, and this 11% plus payroll tax, is that all on the employee, or is that on the employer and the employee?
Well, it ends up, this is money your employer is paying out. In the short run, maybe your employer will swallow it. But in the long run, all of this comes off of labor. This is money, I've sat in negotiations, and the employer has laid out, this is what we're paying in compensation. Now, our health care costs are going up, so do you want us to take that out of your wages, or do you want to downgrade the quality of your health insurance? Your choice. Because the employer just looks at the bottom line. How much are we paying for our workers? And in the long run, all of these costs, payroll tax, Social Security, health insurance, all of those costs come out of labor. The problem we have, I think this is actually our largest single problem as a movement, is that most people don't realize how much they're paying under the current system for health care, because so much of it comes before you get your pay stub. I actually, after this happened, because I had been talking to the governor's office over the summer, you got to make people realize how much they're spending now, because you're going to come in with taxes and people are going to think, oh my God, all this new taxes. But they won't, they have to realize that the taxes will be replacing so much money that they never even see, that doesn't come into their pockets. Mm-hmm. So I went around, I asked my colleagues, PhDs from elite institutions, economists, how much are you paying in health care? And nobody knew how much the health insurance costs at the University of Vermont, University of Massachusetts. People had some ideas, but actually nobody knew. I didn't know. I had to go looking it up, and it was actually not easy to find. But until people realize how much they're spending now, they're not going to appreciate how much they're able to save under a single-payer plan, or even under a hybrid plan like this.
Great, thanks. I think that's what people were looking for, really digging down into that a little bit more, what it looks like from the perspective of a person or worker. So last question before we close this out, and these have been really wonderful questions, so I really want to thank everyone. Matt, there's a lot of questions about federal legislation, about, was the implication from the Shumlin administration that the feds were probably not going to support this effort? Was it just not going to be doable without backing from the federal government? Should there be messaging around national federal single-payer support, legislation along with the fight for state single-payer? Could you just address that as we're sort of closing this out?
Yeah, I mean, I think I really also appreciate the last set of questions and answers by Professor Friedman, to articulate this concept that, so much of this stuff is all connected, right? I mean, our healthcare is completely connected to our wages, to our housing costs, to childcare costs. I mean, it all is connected to our standard of living, and I think it's important. And again, that's another reason why we've sort of had a broader approach on this concept of using human rights so we can help connect some of these issues. I think there's a lot of policy conversations that we could have about how a lot of this will be pushed onto labor and so on, and how we could avoid that. But yeah, and I think, to get at the question that you just asked, these are all really great questions that we should be asking ourselves. It's like, what is the best strategy moving forward? Ultimately, our strategy has always been that we in Vermont, a small state, have the ability to organize our communities to change what's politically possible and really transform a system from the marketplace, controls to a system that's considered a public good. We intended that to be to start a domino effect of other states who say, if Vermont can do it, so can we. We also understand that this would not be a single payer system. We just don't have that capacity in Vermont. This is ultimately towards moving us, in a goal as a country towards realizing our human right to health care. And putting, and I think, we believe the only way that we're going to get there at all, is if we have a people's movement in Vermont, in Massachusetts, in Maryland, in California, in every state, people rising up and demanding that, we actually have a system that takes care of each other. And not just with healthcare, but with housing, with our food system. We have to change the sort of dynamic in this country. And, so I think we should be doing all of these things. We have our role in Vermont, to keep pushing away and push the envelope and test the waters and, and give people hope. But definitely we should be, banging the drum for, setting the stage for moving forward with a national single-payer plan. Ultimately, that's where we need to get, but we all have to be building where we think our communities are ready to fight, and where people are at, where they think they can win, where we can win to get there. And so I'd encourage all of those strategies. I think right now our campaign is going to focus still on trying to do as much as we can in our state to push, to set an example. And we appreciate any support, and we'd love to support anybody else who's thinking about doing the same elsewhere. And again, as we're wrapping this up, I want to appreciate all of you for joining us, and would love to talk to any of you all as individuals and to figure out how we can be better at connecting our movements, because ultimately, our opposition is extremely well connected and well organized, and the only way that we're going to come up against them in Vermont and anywhere else is if we also stay connected and well organized. So thank you for your time.
Great, thanks. And I'm going to close with sort of a next action step. But before I do, I really want to thank the National Healthcare for the Homeless Council and Julie, who's been helping us with facilitate this webinar. We're using their webinar software. So thanks so much to them. And in terms of the next action step, as I mentioned back in December when Shumlin announced this, there was a wave of national sort of right-wing press op-eds, letters to the editor, radio coverage, all that sort of stuff, basically saying, well, we told you so, this isn't possible, you're never going to win, healthcare is a right. Even, an advocate like Peter Shumlin has decided to back off and to give up. So we want to do a National Day of Action where we push back and really respond to that claim. And it looks like probably in mid-February sometime, that's going to be when the Vermont Workers Center, along with a few other groups, works on proposing an alternative to Peter Shumlin's financing plan to show that it is possible, that we can make healthcare right. And so just stay tuned for that date. We'll be in touch with everyone, but that would be a great time to write to your local paper, to try and talk on your local radio station, wherever you are in the country, and to say that, look, this is political. It's really not, we can get there as a country and as a state. So thanks so much, everyone, for joining us. We'll get this up as soon as we can. Take care.
Okay, thank you.
Thank you.